Welcome to the Notes Lane. So, you have finally finished your university exams, and maybe you are stepping into internship, or maybe you have already started preparing for the competitive exams. Then one day you open your old notes, and suddenly you don't feel as familiar anymore. On your clinical rounds, you don't remember anything, you remember everything in fragments, but connecting the dot is the hardest part. Because medicine isn't just about memorizing isolated chapters, it's about seeing how everything fits together. And that's why it's very important to revisit the concepts and connect the subjects and build understanding that stays with you. So, whether you are in clinic or you are preparing for your next big exam, it's very important to go and re-revise the concepts multiple times. But how you're going to revise the concepts and you're going to revisit it again and again if your notes aren't concise or you are afraid to go and see your notes because fear is what holding us back to go and revise it again and again as a student. So how you are going to revise those concepts in easy manner, or also you are not afraid of going to the notes because it's not looking so heavy and bulky that your mind take it as a fear. So welcome to the Notes Lane. We are starting a series which is called Integrated Learning Series. This is the part 1 of Integrated Learning Series. So for me, whenever I try to connect the subjects, it's like a mind web for me. So, for example, if you wanted to learn cardiovascular system, so cardiovascular system contains a lot of topics and a lot of numericals also. So how to study these long topics and most important, how to remember it. So we need to connect the subjects, especially when you are a student who is going to give a competitive exam, or maybe you are stepping into your internship. You need to revise every subject from first year to final year and in internship. So how are you gonna do that? I'll tell you. You need to pick one topic or maybe you need to pick one system. For example, cardiovascular system. Now the mind web. Now in the Stranger Things how the mind flare connect the dots, like which victim he wanted to choose. So you need to pick the system too. You need to connect the webs. Now, cardiovascular system, it comes in almost every year. From first year to fourth year, there is cardiovascular system. Like our study material is based like how you need to study this part in first year and this part in second year. So in the first year, we basically study cardiovascular systems anatomy and physiology. And then in the second year, we study pharmacology. In the third year, we study general medicine and general surgery. But all of these are connected. Like the cardiovascular system started in first year, but then subsequently we learn about how to treat the disease, how to study the pathology, and how to manage it with surgery. So in final year or internship, you need to study everything together. Wow, that's already too much to study and to remember. We humans learn in a graph. Like we have a learning graph, learning curve, and we have a forgetting curve too. So forgetting is a very natural part of your studies. Now for competitive exams or for your internship too, you have rounds and you have to go into different departments to get your studies and your observation done, the patients, their treatment, everything you need to remember. So for a competitive exam, you need to study very smartly. You need to repeat your concepts and you need to concise your notes so that you can go it over and over to build a photographic memory and also a memory where you can pinpoint where the concept is.